Hello, I'm Susan Hennigan. A middle range theory of family vigilance is my chosen study. This particular study is relevant in this time of what appears to be an ongoing COVID pandemic, and we're getting newly limitations restricting patients' ability to have their families with them while they are hospitalized. Um, as we have learned, the four meta paradigms of nursing are person or patient, um, environment, health, and nursing. I currently work on an acute inpatient rehabilitation unit as a nurse liaison. It's my job to get patients admitted to rehab. This unit provides intensive physical, occupational, and speech therapy to patients suffering from any kind of illnesses, strokes, dementia, debility related to COVID. The average length of stay is between 11 and 14 days, and that is after the patient's acute hospital stay. So this theory of family vigilance and having the family involved and around for the patient's care is very important. The person, the first part of the meta paradigm, our patient feels safer, loved, cared for, more attended to, happier whenever there is a family member with them. They don't feel as safe when they're alone. And speaking as someone who lost a family member during the pandemic, it's terrible not to be allowed to be there with them. The environment is unfamiliar, especially to our elderly. Our patients have gone from being ill in the hospital to being ill on the rehab unit, but with the ability to participate in therapy, which means they interact with even more medical people, the therapists now. Health, the effects of family vigilance on the health of a patient is something I observed over the last year. Yes, the physical health was most definitely affected. I feel as though patients don't get better as fast without a loved one with them. But what was really noticeable to me was the mental illness, the depression, the anxiety, the psychiatric consults were up. Mental health is just as important as the physical health. This particular theory works well also too because of our length of stay. Again, 11 to 14 days. That's a long time. You have a couple that's been married for 55 years. Being apart for that long is kind of traumatic for them. And another reason, many of our patients are cognitively or they may have dementia or they may have had a stroke. So having a family member with them kind of anchors them back in reality. The conclusion of the study, there's a couple interventions that I think could concretely be used to improve patient care and patient satisfaction on an inpatient rehab unit. The first one would be that nurses need to be empathic and understand that the families are there because they want to help their loved one. They want to make sure they're safe and taken care of. I think, hopefully that they will allow at least one family member to remain with patients if restrictions go back up. But if not, it is imperative that the nurse does everything to make sure that the patient can see their loved ones. So a simple strategy would be to get an iPad, and each nurse is responsible for taking that iPad into all their patients' rooms and giving them the opportunity to FaceTime a family member. They may or may not want to do that, but at least that's an opportunity, and it's something that they know they're being offered. And the second thing is about communication as well, but just kind of a little bit different. It's to improve interdisciplinary communication with the patient and the designated family member. If the family member is present, communication is better, but it's still not up to par. But one of the biggest complaints I heard over the last year, as I would visit patients to get them admitted, was that their families did not know what was going on. They didn't know what unit they were on, what room number they were in, any medical. No one was calling them and updating them. So a strategy to improve that would be a call from the doctor, nurse, or therapist daily. It could be something as simple as a piece of paper on the patient's door or on the chart with name, date, signature, and who they spoke to and what information was given. That would go a really long way to improve that communication. And then there's also the proof that that it was being done.